Okay, I think we can go ahead and get started. Just to do a little housekeeping at the top, as usual, the webinar is being recorded and will be shared with everyone after. So a follow-up email will be sent with the video and any additional information that comes up from today's webinar. And this is a GoToWebinar format, so everyone's muted. If you have any questions or problems, please use the chat feature. We'll get to the questions at the end of the session, but if you have any problems, just send them right away and we can see what we can do. So thanks everyone for joining again. My name is Owen McCarthy. I'm the Senior Director of Data Analytics at PolicyMap. And in that role, I lead the data development team. We are responsible for the collection, curating, and processing of all of the data you can find on PolicyMap. And today, I wanted to bring a little bit more of a focus onto our exclusive data indicators. That is the PolicyMap data that's hard to get anywhere else. So what can you get only in PolicyMap? Now, I'm saying only in PolicyMap is just to make it a little bit simple. I'm not claiming that literally nowhere else in the world can you get some of these indicators, just that there's a lot of, the bulk of our data is from public sources like the American Community Survey, but there is a lot of data that isn't easy to get in other places, either because of they are custom calculations or because we get them from third-party data licensors, and that's what we want to focus on today. That tends to fall into two categories. So one is enhancing public data that already exists. So that's usually through custom calculations and custom indicators, right? So even simple calculations like a percent change or a median value, they can really enrich public data and are not at all straightforward to do by yourself. Aggregating, that is to say, taking smaller areas and bringing it up to other ones, also involves methodological challenges, but still makes it easier to consume in a visual or map-based format. And then, of course, custom indicators, we're trying to speed up your analysis using pre-calculated indicators that might be of interest. And then the other category of non-public data is licensing existing data from external partners that fills in gaps in public offerings. A big example of this is locations of organizations and businesses outside of medical providers that really aren't tracked by the federal government, right? Or another version might be external data providers that use really cool methodologies that we think our users might be interested in. And then the last category is data that is technically public, but otherwise quite onerous to collect. I'm going to give examples of all of these and show some of the data on PolicyMap today. So where can you find it? Admittedly, there is a huge number of indicators on PolicyMap, and so finding any one can be a little bit tricky. So I want to draw your attention to a few different places because, again, what we mean by exclusive data to PolicyMap may not be exactly what you're always thinking of. So for one point, on the left here, we have a screenshot of our new data catalog page. If you go to the data sources on the left-hand side of the page, you can see a table right here that refers to PolicyMap proprietary and licensed data. And these are basically all of the ones that we identify as either data sets like data from Sergo Ventures or US Election Atlas that we specifically pay for to bring into PolicyMap, or data that comes from a public source that we make significant changes to, like PolicyMap and FFIEC, that enough to make it proprietary and licensed. In the example of, I want to make one point that when we say PolicyMap and ACS, we are not claiming like intellectual property ownership over something the ACS did. It's just to say like, hey, look, this is some custom work we did. And it's also as a transparent heads up that, we changed something or we did our own work. So when you're looking at this, it's not just the ACS, it's the ACS and PolicyMap as well. And if you were to click on any one of these boxes, you would see the data source, some information about that, and the indicators that are included in them. If you go over to the middle, this is a sort of sneaky one, but the variable menu for a particular layer often has data that we provide ourselves. So perhaps the most one that may be a little counterintuitive is percent changes, right? So right here, I've screenshotted a view of the estimated percent change in percent capita income between two time periods. Obviously, the per capita income data comes from the American Community Survey, but they don't calculate percent changes for you. They give you the formula. You can find papers that will explain the formula for how to do that, but actually doing it requires a good deal amount of more work. So we include these here, and it's not obvious that represents work done by PolicyMap, but they are it is valuable and like value add that we try to make for our customers. And then this isn't a guaranteed way of finding them, but oftentimes when you see this little P logo next to a menu item, that's a pretty good indicator that, again, it's exclusive to us, largely in this case because we have made some sort of custom calculation ourselves. So these are all different ways you can find it. But again, I'm going to try to highlight a lot of the exclusive data that we have on PolicyMap here today, but there's always going to be a little bit more that you might stumble upon at a different time. Okay, so let's talk about enhancing public data. So going back to the calculations, I just mentioned percent changes, and we like to say that that brings like sort of time-dependent context to data while preserving that methodological rigor. It's really not all that straightforward to calculate percent changes. If you recall from the previous slide, I was showing the time period between the change in per capita income between 2005 to 2009 and 2020 to 2024. A lot of things happened in that time, and making sure that number ends up being correct is tricky. Another one that we like, this word you might have seen around our menus is predominant. The predominant race or ethnicity, the predominant housing tenure. We like to think of this, the predominance category of indicators, is something we do to bring one view to data sets that have many distinct categories. So just to take a simple example, the predominant race or ethnicity, there are 8 different race ethnicity categories that the ACS provides. If you wanted to look at an area and see, again, what the majority or the most common the modal category race or ethnicity group is in a given area, you would have to look at all 8 layers yourself and then remember them and then do a little bit of math in your head. And so we just create the predominant race ethnicity, so to save you the trouble. You just look at it and you can see exactly what there is. I'll show some of these in a second. Distance calculation. So we try to do this because, again, the main interface is a map, and we want to provide that greater spatial dimension to point or location data. So an indicator there that you might find is the distance to the nearest high-performing school. So we source our school locations from a company called Niche, and then calculate for a given area what the distance to in miles to what Niche designates as a high-performing school. So again, you can see with the point or location data, you can see where they are, but then the distance calculation makes it a little bit easier to see places that are lower access to that particular kind of resource. Another category for enhancing public data might be combining multiple indicators. I'm going to talk a little bit about this more in a second, but the BLS Consumer Expenditure Survey is really, really interesting stuff. Using it, we can create small area estimates of household spending patterns, which I think is hard to find other places. And then, of course, the new markets tax credit eligibility is determined by, there are ACS type indicators related to poverty, but there's a whole bunch of other federal guidelines as well, right, that makes an area eligible for the NMTC. And so we just bring all that together into one layer that says this area is eligible or not eligible. The other large category of how we find or how we think about exclusive data is how do we fill in gaps in public data? So nonprofit locations, school locations, pharmacy locations, these are always usually of interest from policymakers and researchers, but they're not really tracked by the federal government, right? Some states, to take the example of pharmacy locations, some states do provide lists of where these are, but you have to go state by state. Same thing for schools. Nonprofit locations, we'll talk about this a little bit more in a second, is of course technically public information because nonprofits have to submit tax forms to the IRS, but as I'll go into a little bit later, the actual forms themselves are not at all easy to put together. And so in these cases, we work with external data providers to make sure that anybody who wants to say, look at the number of pharmacies in a given area doesn't have to go to a whole bunch of work or do the licensing themselves. You get that all in each 3 of these you get as part of your premium subscription to PolicyMap. Then the last one is interesting methodologies from external partners. These are ones where we're not a terribly big team. So even though when we do custom indicators, we want to make sure we're keeping our library up to date, but other organizations have the resources to put in and make really, really interesting, complex data products that we think our users might be interested in. One that is about to be updated, you'll see a notification pretty soon, if you haven't already, is the Maternal Vulnerability Index from Sergo Ventures. They use, and this is a good example of combining public data in an interesting way. So a lot of the data that they use to look at maternal vulnerability is public from the federal government, from the Department of Health and Human Services and other agencies. But it really allows you to look at the root causes and comorbidities of maternal health all in one spot. In a wildly different theme, the Claritas Prism Premier is market segmentation data. So over 60 distinct market segments for small areas with a ton of rich information, right? Just not something that we are in a position to make ourselves, but we think our users might be interested in, so we bring it in. This is a relatively simpler one, but it's still really worthwhile. The Intercontinental Exchange produces home sale price estimates. So you can get home value estimates from the ACS, but that's self-reported, right? And of course, it's a survey. The ICE gives actual median sale price values for a bunch of different housing types, so single family, even mobile homes. And so that's really, really interesting to see like what median sale price is and how that changes over time. And these are the sorts of, when we look to license data from third parties, this is the sort of thing we're looking for. Where is there a gap in publicly available data? And is the methodology really, really interesting and of value to our users? So I'll switch my screen right now and show you some of those. So going back to one of the first points I made, the percent change calculation can be a little tricky and counterintuitively tricky as well. So right now we're looking at, by county, the estimated percent change in the median income of a household between the period of 2005 to 2009 and 2020 to 24. These are 15-year percent changes in median household income. So the census does provide this median household income variable. You can find it directly from the ACS or on PolicyMap. But now, suppose you do want to see how that changes for census tracts in an area. To do that, especially for this long of a time period, right now we're going back to the end of the Obama administration, to the present day, excuse me. So you have to account for the fact that some census tracts have a very small number of households, and so that a percent change in, say, a place that only has some census tracts have really less than 10 households. It's not, that percent change is not going to be meaningful. You can calculate it, but it just won't be worthwhile. You further have to account for the fact over this very, very long period. This time period we're looking at here spans 2 different decennial periods, right? So there was a lot of changes in census tract boundaries over that time. And of course, the changes in census tracts are due to changes in population, which is really interesting and again connects back to the 10 households thing. So what we do here is make sure that we're only calculating percent changes for tracts or counties or whatever that has a sufficiently high number of households so that the percent change is itself meaningful. And we do what is called bridging between all of these census tract boundaries over this period to make sure that, this census tract here on the north side of Baltimore, excuse me, when we say the 45, it has a household income, median household increase by 45%, that really is a meaningful number given the households that live there and the period of time that we have covered here. These calculations are possible to do, but they're, again, something of a hassle, and we provide all of those calculations right here in PolicyMap. So we do this for multiple time periods as well, especially for the ACS, going back to the 2000 decennial census, but also the 5, 10, and 15-year ACS periods. The 10 and 15-year ACS periods are new in the ACS release from this year. And so this is, again, something you may not have noticed in the past or may have thought was provided by the census, but it's actually something that requires a fair amount of effort that we want to provide to our users so they can go very quickly to insight without having to worry about all the methodological challenges. We talked about another category, which is predominance. And there we want to look at chronic conditions in this case. Actually, let's look at a different one first. So the CDC, through their places data, offers at the county and zip code level 13 different chronic diseases and their prevalences for those areas. But if you wanted to just do an assessment of a particular area and what their chronic disease burden is, again, like my earlier example, you would have to look at all 13 and look at the percentages and then make it a sort of assessment of what is the highest burden, right? So from here, you can zoom out to the country and see that, unsurprisingly, that once my browser loads the layer, you'll unsurprisingly see that a lot of places in the country have the predominant chronic condition is some of the most common chronic conditions in the country, right? So you can see here in West Virginia, there's a lot of zip codes that have high blood pressure, high cholesterol, obesity. You can still find pockets of other conditions as well, though. In this case, depression, chronic kidney disease over here in Arkansas, or arthritis as well, that you can see down in Florida. And then for any one of these zip codes, you can see not just the most common. If you click, I want to draw your attention to what happens when you click on a particular zip code. So here it looks like the northwest corner of Virginia. So in this particular zip code, the most common chronic condition is high cholesterol at 36.7%. But then you can see the levels of all the other chronic conditions as well, up to the top 10. And so you can see, okay, high cholesterol is the most common problem, but of course, blood pressure and obesity are also fairly common problems as well. And so again, rather than clicking through all of the different layers that we have here, we offer one simple view that can give you just a quick hit of all the chronic conditions in the area. In a similar vein, we created an index that, following the methodology of the CDC, that designates any particular zip code as having a low, a moderate, or a high chronic disease burden. So rather than saying this is the most common chronic disease in an area, does this zip code have a particularly high level of chronic diseases, right? And so when you can see, this is largely, though not exclusively, a characteristic of urban and rural areas. But you can look at a particular area, in this case, in the southwest corner of Philadelphia, and see not just, you can see that this zip code has is in the highest tier of chronic disease prevalence, but then you can also see these are percentiles. So in this case, this one particular zip code is in the 96th percentile of asthma, right? And relatively lower in some of the other disease categories as well. So again, if you just want to look at any individual chronic disease prevalence, you absolutely can. But if you want a quick view or a more comprehensive view of a particular area, we put these custom calculations together to make that a little bit simpler for you. So changing pace, I talked about consumer expenditure surveys. So let's pull up this one. So again, affordability and the cost of living has been in the news for quite some time now. And of course, that spans a lot of different data areas. But what you'll find if you look around is a lot of it is hard to get at a small area level. Now, there's a lot of very reasonable methodological limitations here, but one of the data sets we like a lot is the Consumer Expenditure Survey from the Bureau of Labor Statistics. So again, this is a survey, but it does provide estimates for the amount spent on a lot of different household spending categories. And so housing, food at home, food away from home, alcohol and education, and then also on medical spending estimates as well, on prescription medications, office visits, dental care. Really, really interesting data. But again, it's a survey. So what you end up getting is like, this is the median amount for particular household types. So what we do here is take those survey weights and then use ACS data to create small area estimates of how much. So this is just the highest level, the highest aggregated indicator. So you can see the amount spent on all household expenses for particular areas. And if you zoom out, you'll get a sense of, again, not terribly surprisingly, a sense of what are the most expensive consumer areas in the country, right? And where are some lower cost areas as well. And again, the BLS data, the ACS data, that's all public. But if you wanted to put this together, it's a fair amount of work, and we think we can create value and provide value to our users by putting this all together and just making it look like an indicator like any other. But it's easy to miss if you don't know what you're looking at. So to change our pace again, I want to go back to talking about locations that are not otherwise centrally tracked. So one we get asked about a lot is the locations of nonprofits. Now, I mentioned this falls into the category of technically public but onerous to collect. The reason for that is nonprofits are required to register their status with the IRS, but that data only really exists as digitized tax forms. So it's really, really tricky to process. And then there are data quality problems with delays in the IRS reporting it, and sort of what you might think of as stale nonprofits that technically exist on paper but don't actually do anything. We source our nonprofit location data from Candid, which is one of the market leaders in this area, and then build a lot of filters that allow you to focus on the types of nonprofits you care most about. So the reason for that is nonprofits means nonprofits, right? It is everybody. Just a little anecdote from when we were first processing this data. We were looking at the net assets of every nonprofit and just wanted to see what the highest value was, just to make sure we had calculated it correctly. And the top, the organization with the highest net assets, it was a very, very large number. It was in the hundreds of millions or billions of dollars, and which was like, that's really hard to imagine for a nonprofit, until we looked up and saw that the name of the nonprofit is the president and fellows of Harvard College, right? Harvard has a very large endowment. That's basically what it's going. So nonprofits is everything, not just a food bank or a shelter, but very large private universities, clubs, associations, foundations. It's everything. So you really, if you can look at every single nonprofit, but there are millions of them across the country. So I recommend using the filters here. So I filtered down to, now we're looking at Philadelphia, the type of group it is. So these come from the National Taxonomy of Exempt Entities. Again, basically they have to declare to the IRS what kind of nonprofit they are. And so would be mental health or crisis intervention. And then I wanted to look at those that have revenue between 50 or at least 50,000, and just basically exclude the very, very small nonprofits. And so now you can see right around Philadelphia where they are. If you click on them, you can see population served, subject areas. Some of these are filters as well, by the way. You can see a website, and then some of the net assets, the number of employees, all these come from the IRS. Again, you can just Google Council for Relationships. You'll probably end up on Candid's website, truthfully. But if you want to look at the number of nonprofits in an area, this is the best way to do it. And this really does, otherwise, trying to do this with public data will be quite onerous. A similar example is school locations and school performance. Zoom this out. So here, again, we get these from niche.com. This is available to anybody with a premium subscription. And it's, of course, possible to buy from Niche directly, but it's just nice to have it along with your premium subscription and PolicyMap as well. There's a lot of different types of schools. I should say we see there are grades on their academics. A lot of this comes from Niche itself and their proprietary algorithms that do this sort of thing. But if you just want information on the URL, the Niche profile, the school type it is, you can see a lot of them here. And then again, I referred to the distance to the nearest high-performing public school. So this is what we do. So we look at, you can say, load a layer of, okay, so let's see the distance in miles to the nearest high-performing public school. And you can see it's this is, in this case, we're looking at a function of density, right? So in Center City, Philadelphia, obviously things are quite close. In New Jersey, over across the river, it's a little bit farther away. And again, we make that calculation ourselves. So even if you had the locations, you would need to do some work to get there. And so I think this is really valuable to show not just, okay, where are the schools, but to take that next extra analytical step and say, how far are particular areas away from a high-performing school. The um, the last one I wanted to share was the market segmentation data from Claritas Prism Premier. This one's a little bit different. It's available to all academic and library subscribers. It is available to folks with a premium. It's just a small additional add-on fee that's required by our data provider, by Claritas. So, like I said, this is market segmentation data that we would not otherwise try to create ourselves. You can imagine a market segment in this case, for anybody who doesn't know, is a sort of very detailed profile of a particular group of consumers that includes demographics, income, wealth, family size, age, consumer habits, consumer interests. There really are quite a lot of them. There are 68 distinct segments. You can see that when you look at them in PolicyMap, they are arranged approximately in order of descending income, though they're not solely defined by income. But you can see here upper crust. I should say they also have these specific names, which can be a little hard to understand. So what I like to start with is the predominant segment map. And so you can zoom out of an area and you can see which consumer segments are most common in an area. So like I said, in this case, the red census tracts are, generally speaking, higher income, and so it's a way of seeing that there. But they're also, for anybody who wants a really deep dive into exactly what the most common population are here, you can click on any one of the segments, and you can see not just that segment, which other segments are around either, and then we link out to the Claritas's segment detail page. So this one is called Movers and Shakers. A quick description of it is wealthy, older, mostly without kids. And then you can see their determined demographic traits: suburban, wealthy, largely millionaires, age ranges, mostly without kids. Like really, really interesting. Because like I said, some of these are a little, I'll speak only for myself and say they are a little hard to understand. To pick out one, let's see if I can find. Okay, Mayberryville. I had no idea what this meant. Turns out it's a reference to the Andy Griffith Show, which I am embarrassed to admit went straight over my head. So again, you can figure some of them out just by the names. They are approximately arranged by income, and then you can always click on any of these and really see exactly what Claritas means here. So again, just to wrap, that's the last example I want to bring up. I can easily go back through any of the other examples or any other ones that folks might be interested in. Again, the theme here is that we do have a lot of public data in our platform, but we recognize that public data has limitations, right? It's only produced for a very specific use, analytical purpose, and so we want to make sure, sort of expand the analytical purposes we can use it for. It doesn't provide some even basic calculations that some of our users might be interested in, so we want to do those calculations. And of course, public data can't capture the location of every sort of organization that might be of analytical or research interest to our users. So we want to go out and find data providers that do share those locations of those, again, the pharmacies, the nonprofits, and things like that. And then finally, we look for really interesting methodologies that bring out a view of what, like, combine lots of data into a single view. And I actually just remembered, before we go to questions, I said I would talk about the Maternal Vulnerability Index, and I didn't, which is a real shame. So I'll do that very quickly. So like I said, the Maternal Vulnerability Index comes from Sergo Ventures. It's a really, really interesting data set. So it uses 43 different indicators. Again, they are largely public, to identify where and why mothers in the US are vulnerable to poor health outcomes. So the first layer you see is just the overall index. Higher is a higher level of vulnerability. And then when you click on an area, you can see the different themes. like I said, there are 43 indicators that go into this index. They're grouped into 6 different themes. So reproductive health, physical, mental health and substance abuse, general health care, and socioeconomic determinants, and physical health environment. So you can see here, there is the drivers of vulnerability in this part of New Jersey are largely socioeconomic, right? So these are the very, very high value. So this is a largely poorer or more materially deprived area. But that's not the case in other places where there might be a higher chronic disease burden that you might see. And then, so let's see here. Yeah, so here mental health and substance abuse is much, much higher, much a bigger driver of vulnerability than other things. And you can go back and see inside of risk factors, maternal vulnerability, you can see layers. So let's see the one it's where the reproductive health care is the biggest driver. Zoom out a little bit. So this is what I like about it. There's so much maternal vulnerability. You need lots of sort of health outcomes, have so many different causal factors and so many different comorbidities. The maternal vulnerability index brings all of them together in one spot. So you can see here where the much bigger driver is just the reproductive health segment. We do have information about the themes, but you can also, so reproductive healthcare includes access to family planning and reproductive services, including abortion. But there, you can also go to the MVI website and get a much more rich description of all of the themes that go into. So again, a lot of the data that comes into this, access to particular types of doctors, income and poverty, physical health, chronic conditions, that all exists in PolicyMap. You can find it in our menu. But this brings everything together into a single index focused on maternal vulnerability, which we think is really, really powerful for our users. So that's it for my demo. I'm happy, as I mentioned, I'm happy to go back and review anything that we've talked about or just answer any questions that the folks might have.
Thanks, Owen. I always learn way too much more stuff, which I apologize for anyone in my trainings next then. A couple of questions that did come in, definitely one regarding about social vulnerability index. And that is there any idea of how the suspension of possible cessation of the federal PRAMS program affect the future updates?
I'm sorry, the federal PRAMS program?
PRAMS.
I'll admit that I'm not familiar with that program. I will say, though, that we are operating under the assumption that the SVI is not going to be updated anytime soon, which is a real loss. That is a really, really interesting, which we do have. It's now stale, but you can see, let's see, where do we put it? It's stale, but it's still of value. So we have a few paths forward that we can that we would direct our users to. So you can look at the old social vulnerability index, which is as of 2022. We do partner. I didn't mention this just for the sake of time, but we do partner with the University of Wisconsin-Madison. We're actually going to get a new version of this, hopefully in the next few weeks, of their very cool data set called the Area Deprivation Index. I have heard from some public health researchers that this is another one that is really, really valuable. And certainly, if in an area without the SVI, it's a real useful value. And then the last thing is, we are going to look into seeing how we can use the this. I will say this is a research and development project for us. So there's a lot of things that could block us from doing it, but we are going to look into see like the data sources of the SVI and whether we could create a methodology that is similar to it that might be useful to, because as we understand it, the data is, most of the data just comes from the ACS and that's being updated. It's just not the index itself that's coming together. So again, you can look at the old SVI data, you can look at the area deprivation index, and with any luck, and we'll certainly tell you if we are able to do it, hopefully us or somebody else will be able to recreate something like the SVI in the future that might be useful. But yes, I mean, I don't know exactly what's going to happen, but we are operating on the assumption that the SVI just isn't going to be updated, at least anytime soon.
Yep. Yeah, I think that was Anne's question, and where Anne, the second half of her question, which is a plan B in case it doesn't get updated. So good to
Well, there
know
you go.
that we might have a methodology. A question about the Prism data. One of the things I think it's always my favorite data set, just because it's such a unique way to look at data and just how it's created. We did get it for both public libraries and universities because they use it in business planning and understanding of neighborhoods and such. So I think Emily wanted to find out just to see where it was at again, and I believe they are a university, so it's under curated. Yeah, so you can.
If you are at a university, or you should be able to find it through under curated collections and market segmentation data from Claritas Prism Premier. I'll take the opportunity to just go through the menu a little bit more, because again, there are 68 segments. Those segments, as Phil mentioned, are for business and market analysis and planning and things like this. So Claritas groups segments into what they refer to as social groups and life stage groups. Again, approximately urbanicity, approximately life stage, right? So you can see, and within there you can see higher income to lower income, and then so it's a way of just I'm not trying to pick on Claritas's naming convention, but there really are a lot of different names here, and so if you weren't exactly sure what, say, pools and patios might refer to, you could say, okay, it's the age of, maybe there are younger kids and higher income as a general rule. But you can click on any individual segment and see where they are most common in other places. So you see there's a lot of, it's more not the most common segment, but you can see them in Southern California, Northern Nevada, and Southwest Arizona as well. But yes, you can find that inside the curated collections, market segmentation data from Claritas Prism Premier.
Yep. Yeah. It's always fun to play around with it. And again, it's when we show it off in our trainings, you get really lost in there because there's just unique ways, especially the searching function, the ability to search for the keywords that are within each segmentation makes it really interesting. You can search for WWE and find out who watches WWE or drives Cadillacs. Yep.
Yep. There you go. Great. Thanks, Phil. I forgot to highlight that. Yeah.
I think there's just some. I always appreciate the predominant race or predominant layers. There's just really cool ways to present the data. So one of the questions is there any upcoming predominant layers in the future?
That's a great question. We try to view predominant indicators as a relatively quick or easy win that we can add in for when, again, there are a lot of different categories, and we think that they could view the predominant chronic conditions was the last one was relatively recent. It was maybe about 6 months ago. I don't know if we have specific ones. We're always evaluating possible candidates for these, but I don't know that we have any that are coming out immediately. But it is something that we're always trying to keep a focus on and see where we might be able to create them. I will say one thing. Another R&D project for us is trying to enhance our collection of data related to household finances and affordability. And so I could imagine we might see an application there, because there are so many different categories of household spending that you could pick. The other one that's coming up is actually a colleague is working on predominant income band. So and that one should be coming out relatively soon. So if you look at household income brackets, the Census Bureau produces these categories, but again, it's the same problem. You can look and see where there are, 125 to 150,000 people dollars in annual income, but that's only so helpful, right? And so looking at the predominant income band allows you to get a sense of the income distribution of an area. So you can see, again, we'll have one of these what we would call a multi-indicator info bubble that you can see. Just take a different example right here, and this set of other values down here. So you'll be able to see the kinds of like the percentage of households in each of the ACS income bands all in one go. So maybe, you could look at a place that it has both very high income households and very low income households. Manhattan is a good example of that. And you can really get a sense of how many households fit in each of those. That's probably the next predominant indicator that we plan to release. But again, we always try to find opportunities to use that framework.
Perfect. Yeah, I'm very excited for the income band. I think it's just a really neat way to see the income distributions around a given area. All right, so if there's any other questions, please just use the question fields. As you can see, questions are pretty easy, and we try to answer much as we can. Otherwise, I do have one just last question that came at the very beginning, which when we were talking about percent change calculations, and they were just wondering if we also do calculations against the different vintages that occur.
Yeah, I'm assuming the different vintages refers to boundary vintages.
Yeah.
Which is to say that, and that's what I was referring to. We absolutely do. You have to account for that when you are. Let's see, where did I put that? I think we've got too many. I've got too many layers up. So let's go back to that. So, going back to, we definitely do what we're seeing here. This is in the weeds for anybody who wants to hear detailed GIS kind of talk. So we are showing everything at the 2022 census boundaries right here. But of course, that's what we would mean by the vintage of that time period. But when you go back, if we're counting the percent change going back to 2005 to 2009, like you absolutely have to. Some of the census tracts in 2005 and 2009 are very, very different. They get grouped together, they get split depending on population shifts. And so you absolutely have to take account for that. Depending on, let's see if I can think of a different one. And you can go, an easier one. And then of course, you can also go back to different periods too, right? So now we're looking at the 5-year percent change between 2010, 2014, and 2015 and 19. There are fewer boundary vintage changes because that's all entirely within one decennial period. But if you want to go expand them, and we want to make just the percent change calculation just generally available. But this is something, let's take a wholly different example. Yeah, let's do unemployment, because that goes back really far. So we don't calculate percent change for unemployment. Excuse me, that's not a good example. Let's just do population. So again, you can see the percent change for all of these different ACS periods and some decennial periods as well because it's population. And you can pick any particular time period and go back and still see percent change from, say, 5 years prior. And so there's just a lot of, we have spent a lot of time thinking about boundary vintages, and yes, that's absolutely something we take account of.
Perfect. Yeah, I think the vintage thing is always an interesting part of the world of PolicyMap, worrying about boundaries and such. And I think that's it. Otherwise, if there's any other questions, I think any questions related to access will follow up directly. But otherwise, thank you so much, Owen. I'll give you the platform.
Okay. Thank you again, everybody else, for joining. If you have any questions, please send them along. I'm always happy to. If you have any, one thing I will highlight as well. So if you have, I don't know, suggestions for something that we don't have. So like we don't have locations of nuclear plants. I don't know where we can get it, so please don't suggest this. But you can always you can suggest data that you're not seeing in PolicyMap. I do look at that. I do follow up, and we do use it as when we're planning our data addition pipeline. So if you have any suggestions, if you have any questions, I'm available. And again, thank you very much for your time.
Awesome. Thanks. We might just be added to a watch list now, but thank you, Noah.
Yeah.
Have a good one, everyone.